everyone, welcome back to Nurse Katherine here. Welcome back to another educational style video. In today's video, I am going to be showing you how to place a tourniquet the best way when you are putting an IV site in a patient. There are so many ways you can place a tourniquet on a patient, but this way is best for the patient and it is best for you, and it will make your job as easy as possible, especially if you're in a crazy situation like giving CPR or this patient is wailing all over the place. This is the best way to put this tourniquet on, and it will just make your job so much easier. This way of placing it can be used for infants and it can be used for adults. Either one will work. Before we get started, hit that subscribe button right now, right below this video, so you are notified when new videos are coming out every single week. But let's get started. Alright, today I am going to be showing this to you on a pediatric mannequin and an adult mannequin. I am using this as a tourniquet. This is normally what you will get in a IV kit, and it's the elastic band. It's not like a stop the bleed kind of tourniquet. This is simply just to get those veins pumped up so you can successfully place that IV site. First, we will start with our adult patient, then we will move to our pediatric patient. Now remember, for your adult patients, never place an IV site on the same side as a dialysis catheter that is still currently being used for dialysis, and never place an IV site on a side of somebody who has had a mastectomy on that side. At the hospital I used to work at, we actually used to place pink bracelets on those arms, and that would tell us never to use that arm for anything. Alright, so let's change screens and I will show you how to place this on an adult patient first. Okay, so here you have your patient's arm, and I'm going to place this tourniquet as if we would be placing an IV hand site. So I'm going to put my tourniquet up here. So first, you simply just wrap the elastic around the arm. Then you cross them just like you would be tying your shoes. So you see how tight I get that? That's exactly what you want to do, because you want to allow those veins to pump up with some blood. So you see how it is crossed. Then I'm going to hold them and pinch between two fingers, nice and tight, and just drop this portion. Now this big portion that you dropped, you simply, all you have to do is take your finger and tuck it under. And that is it. That's all you want to do. And now you can see you have these two piggyback little pig ties here. And when you go to take this tourniquet off, once you get your flashback in your IV chamber, all you have to do is take that piece that you tucked under and pull it, and it simply just comes right off, and you're not pulling the patient's hair, and you're not really hurting their skin either. Now I'll do it at a different angle for this pediatric patient. This angle is if you were standing on the patient's right hand side at the bedside. A lot of pediatric patients get foot IVs, at least that's what I have seen. So we're gonna do that. So I'm going to place this tourniquet up near, let's do the calf area. So you pull it really tight again, and make sure you have someone to hold that leg down, or else they're gonna be squirming all over the place. And you cross, again, cross those bands. Hold, I'm right-handed, so I'm using my right hand to hold that. I'm sorry, I'm using my left hand to hold here. This is the pigtail on my right hand, and I am taking this and just tucking it under, and that is it. Now here is that pigtail that I created again, and all I have to do when I'm ready to take this off is simply pull that, and it comes right off. So everyone, that is the best way that I have found in all 5 years of placing IV sites, well, almost 5 years of placing IV sites and placing countless amounts of IV sites. this last year and a half in the ER, that is the best way I have found to place a tourniquet. And I teach that to all the nursing students and all the new nurses that I'm precepting, how to place that tourniquet that exact way, because that is what will be best for you and make your job easier and will be best for the patient. Now, if you have an older patient who has very frail skin, or if you have a patient who has really hairy arms, you always can actually place this tourniquet over top of clothing. And if your patient has really bad veins, you always can put 2 tourniquets on. I actually learned that from an IV site nurse who literally her job was to just go around and get IVs on all these hard stick patients. So keep those tips in mind as well. But other than that, that is it for today's video. Thank you for tuning in, and I will see you in the next video posted. Today, I want to thank Code 1 Training Solutions. I'm here at the Atlanta office, but they have 22 offices up and down the East Coast from Maine to Florida, just like this. Bigger training facilities and small rooms just like this, where they have their beacon system, which is RQI, and a live person watching you and helping you through your BLS and ACLS training. In the hospital that I used to work at, we used to do RQI training every quarter. Here with Code 1, you actually only have to do training every 2 years. This gives you a 2-year BLS certification with the mix of RQI, a mix of somebody watching you here on the screen. For more information about Code 1 Training Solutions, you can pop down to the description and find links to their website, Instagram, Facebook, and LinkedIn accounts. Again, thank you so much, Code 1 Training Solutions, for allowing me to use your space to create better and more in-depth content for my viewers.